Hi, I'm Michael Hofer from the G Academy. We are here to help physicians to give the best care to the patient, and I'm very happy to welcome Yulia Vyzhga from Ukraine. Hello, Yulia.
Hello, Michael. Very nice to meet you and to see you again here in Lausanne. I'm Yulia Vyzhga, pediatric rheumatologist from Ukraine.
And you are working as pediatric rheumatologist since 9 years in Ukraine.
Yes, it's almost 9 years for me being
And
pediatric rheumatologist.
you are now facing this terrible war, and I'm sure you developed a lot of strategies to continue your work, and would be nice if you could share some tips with our audience. I have a few questions for you. How do you keep in touch with your patient despite the war?
So that is the most problematical because due to the war we had a lot of the displaced patients. According to the official statistic, by the way, now it's up to 30% of all our patients are abroad. All other 65-70% are staying in Ukraine, but they're displaced, totally displaced from the eastern part of Ukraine. They're moved to central and western, but you know, we have usually in pediatric rheumatology, we have very deep contact with our patients, and if they started once treatment with you and you are continuing to follow up them within the years, they're more preferring to be closer to you. So even if they're displaced, they want to follow your consultations, recommendations, because that is a level of the trust that we developed within the years. And of course, we were faced with the problem, how did we continue our interaction? Because if they're displaced within the Ukraine, within the cities of our country, they're able to get access to all the public medical health care system, to all public hospitals whenever they're placed. So in any city they're able to come to the hospital to attend physically, real person contact with pediatric rheumatologist or pediatrician they need. But if they want to contact you directly and you are not at the same city, you have to figure out how to do this online consulting or telemedicine really feasible. So we developed a couple of the strategies. They're, of course, they're not validated at some national level because we don't have any regulations how to do it correctly, but just the situation in Ukraine influenced it. So we developed a couple of the strategies of the Zoom meeting consultations when you're as a physician from one side and the parents and the patient from another side. Of course, and we are explaining for all our patients that any online consultation will never substitute real consultations. It's not the same that you are seeing this child in person, but sometimes
for this Zoom consultation, do you see a difference? Because we have to examine the patient. How do you deal with this part, with articular examination?
So it's easier with the patients whom you followed up for some period of times longer, so they know what you will ask them to perform, and everything depends actually on the parents' skills. If they're able to put the camera in front of this child to show directly. Sometimes I ask to send me photos of the child, knees, ankles, etc. before the consultation to understand what gonna be the topic about, and we are asking to do some simple movements and to fix the camera.
So a lot of observation finally in our examination.
The problem that of course we are not avoiding probably some mistakes potentially that can be obtained, because you know parents, they can be over attentive to the child, especially if they have severe chronic diseases. They are more accented, they're listening to every complaint like very something importantly serious, but it does not mean that all the time it's the same. So some of the consultations, you know, it's like about to stay them calm, that everything is going fine.
And for teenagers, for example, do you do consultation only with the teenagers, or because of this Zoom consultation you have also the parents?
I'm asking all the time for the parents to be present and for the child, because even if you had very trustworthy relation with teenager before it, still that's teenager, we have to pay attention on some habits of them and type how they're expressing their emotions, complaints, etc. So for me, for example, it's easier if I'm not seeing the patient in person to contact with the parents as well, but mandatory to ask the child their opinion and parents their opinion, and then you're trying to make the general picture of this.
And for investigation, for example, for ultrasound, joint ultrasound? How do you proceed?
I will tell you that probably that is most problematic, but it was a problem even before the war, because if you're as a pediatric rheumatology don't perform by themselves ultrasonography, you have to obtain or to work with really skilled doctor who will perform for you this ultrasonography of the musculoskeletal system. For example, in my city in Vinnytsia, I have very good physician whom I really can trust, because she was actually, by the way, trained by Professor Martinoli, so she's really highly experienced in musculoskeletal ultrasonography. And the most important for us to obtain the scans, not conclusions, to see by ourselves. But when we are receiving results from other cities, it's sometimes very doubtful, because you're seeing conclusions that does not respond to those that we are expecting. So that's really very, very tricky, and sometimes we are asking to go once again, or probably to go to another place. So
and for treatments, do you have access to the same treatment you had before the war, and how do you deal also with patients who are not close to you with administration of infusion or other treatments?
So here is this was actually the tricky question before the war as well, because for the coverage of those medications that are reimbursed in Ukraine, we had some problematic aspects before the war, because not everything is covered. We don't have everything that we would like to have as pediatric rheumatologists, but with the onset of the war, of course, we had some problems with delivery of the medication, so not everything was promptly delivered and in time, but anyway, access to the conventional DMARDs, biologic DMARDs from those that are registered in Ukraine is still present, but it's another problem how you will do these injections or infusions. So if the patient is at the Ukrainian territory, we are able to send them to another governmental hospital and they will receive it, because we don't have in Ukraine those so-called to give some drugs with the patient and they will do it at home, for example, if you're talking about the single injections, of course not infusion. So they should do it mandatory at the hospital. It's so generally regulated. For those who are abroad, it's a little bit another situation. They're coming to the pediatric rheumatologist in other countries with our discharges, and then they're receiving this medication for at least for 3 months, and then they're returning or back home, or they're continuing where they're staying. But still they're continuing their medication, so that is not a problem of the interruption of the therapy that much, but mainly with what they're able to receive, because they're receiving almost the same that they received before the war.
Okay, and we all know that chronic disease has a great impact on the families and on the patient. Did you see a difference with the war? Because the war, I imagine, has also a big impact on the families. Did it make it more difficult for you to take care of your patients?
Definitely it did, because when we are talking about the chronic patients, it's some level of stress by itself. Because first it's very difficult for them to accept the diagnosis, then to recognize that the treatment in this way it should be done. And now imagine you have a newly diagnosed patient who was just at the onset of the medication of the therapy, and the war occurred, and it's stress by stress. So it's double stress. Stress for everyone, because first of all, they don't know what to expect them tomorrow. Second of all, they don't know what to do with this child with newly onset but chronic serious disease. So definitely it's impacted a lot, and a level of the worriness among the patients and among their parents rise in times. It's really very difficult, because when the person is unstable in its life position, they can't truly dedicate themselves to the child and the child condition and ongoing medication, etc., etc. They're more worried about something more global. So now it's probably, I noticed that now during the consultation that usually lasts up to 1 hour, 45 minutes, 1 hour, probably 25 minutes, it's just, some psychological aspects that you're explaining, that the disease has its own course, so the disease does not regulate your life. You should know how to control the disease, etc., etc. So it's more now like you're half a pediatric rheumatologist, half psychologist, but it's mandatory, because in other way you won't build this, compliance between you and patients and family.
You are here in Lausanne for the CLIPS project.
Yes.
And so the clinical practice strategies, or real life strategies that we study in SOJA, in systemic onset juvenile arthritis. What did you learn from your stay here in Lausanne? Will you bring something new for your practice in Ukraine?
That's absolutely amazing, Esther. Sam, thank you so much. That's really a great opportunity. I'm totally in love with your team. I was in love with this team 2 years ago, and now once again and again, because it's really perfect and worked absolutely amazing. So this project showed us the most important thing, that real life practice and those that we are planning to obtain in the ideal situation, in the perfect world, it's not the same. We have our real life and we have our real patients whom we need to treat according to our possibilities, and we have absolutely perfectly written consensuses and guidelines that are for repeating not all the time are applicable for our real practice. So if we're talking about a CLIP strategy, it's really very helpful for majority of the physicians around the world, because I'm more than sure that not majority is able to follow strictly some guidelines or recommendations. Majority of us, we are selecting among those that we know and know how it should be done perfectly, but we are selecting the best options for our patients to treat them carefully, correctly, and with a better outcome, the best outcome, I would even tell.
Thank you very much, Yulia,
Thank you
for this interview and for all your work, and all the best for you for the future.
Thank you.